Okay. All right, so we're going to go ahead and move into the award segment of the conference, which is really exciting for me. It's where we are able to really shed light on the work that's happening out here because folks are really working to improve health justice and reentry. And so we're going to go ahead and bring Mr. Nicholas Crayton to the stage, and he will introduce our two Community Reentry Champion Award recipients for the 2025 Illinois Reentry Conference. Here you are. Oh, head off.
First, before I cover that, something that the sister pointed out earlier, I just wanted to cover. For those of you that are not justice impacted, I need for you to understand we are in alignment with you because you understand suffering. That is the common thread between all of us. We just experienced it in an artificial environment. You experienced it in a natural environment. So please understand when you fighting for us and you speaking for us, the disconnect is not that big. So just remember that, sister. I just want you to understand that. As a recipient of the 2024 Community Reentry Champion Award, I am honored to pass this year's baton on forward. The Community Reentry Champion Award recognizes those who make significant contributions to reentry, focusing on innovative programs, advocacy, research, and HIV prevention. We'll be honoring two fearless leaders in the reentry space who work to improve the health and lives of people who experience reentry. Today, we'll be honoring two dynamic leaders who are known for going above and beyond to support people who are justice impacted returning into communities. First, before we welcome the first recipient of the Community Reentry Champion Award, Cindy Casey, I'd like to provide some background information on Cindy. I see you, Cindy. Cindy Casey is a certified recovery support specialist and plays a pivotal role in the Illinois Department of Human Services pilot program called Successful Reentry. This program focuses on supporting justice-involved individuals as they transition back into the community, ensuring they have the resources and guidance needed for a successful reintegration. With a strong commitment to advocacy and support, Cindy brings a wealth of experience and compassion to her work. As a person in recovery, Cindy uses her personal experience as a guiding light to many others. Cindy is dedicated to making a positive impact on the challenges of reentry and build a foundation for a brighter future. Cindy, will you come up and join me, please? Let's congratulate Cindy again. And next, it is my honor to share our Community Reentry Champion Award recipient, Marketta Sim. Marketta could not be here today to accept the award, but we certainly wanted to be sure to recognize Marketta in this space. So Marketta Sims is the mother of two children, and one of whom she lost to Chicago's violence. Upon her release after 13 years of incarceration, Marketta endured domestic violence, yet she channeled these painful experiences into a powerful commitment to advocacy. For nearly a decade, she has been a passionate advocate for reentry and homelessness, understanding the deep connection between the two. Her mission is to not only help others regain stability, but also empower them to create lasting legacies for themselves and their families. Marketta's dedication to her community and her ongoing efforts to uplift and empower justice-impacted individuals make her a beacon of hope and a powerful catalyst for change. We want to thank again Cindy and Marketta for their tireless work to improve the lives of people who are justice impacted. At this time, I would like to introduce the next presenter, Sharon Curry, to the stage to introduce and award the 2025 Health Justice Legacy Award.
Good afternoon, everyone. Okay, let me get in position. Okay. I was asked to read this first before I read my presentation. First, before we welcome the first recipient of the Community Reentry Champion Award, Sydney Casey, I'd like to provide, I think you gave me the wrong page. Sydney Casey.
Sorry about that. This is the Health Justice Legacy Award.
Okay.
So sorry about that.
Okay, so the Health Justice Legacy Award, and I want to note to the receiver, this is the first award of its kind by this agency. So I'm very proud of that. Recognizes individuals or organizations with lived experience in the health justice and reentry space who have made transformative contributions to the well-being of justice-impacted individuals. This award honors leaders who have demonstrated longevity in the field through innovative programs, advocacy, research, direct service, and HIV prevention. It emphasizes the importance of lived experience in empowering individuals returning to their communities after their incarceration and highlights the interconnectedness of health and justice. The award celebrates those committed to improving health outcomes, particularly in HIV prevention, while fostering dignity, healing, and did you have a second page? Okay. And opportunities.
Opportunities for individuals navigating reentry.
Work with us. Opportunity for individuals navigating reentry challenges. Thank you. Okay, so now. This is what I wanted to say. Okay, and it is my sincere honor to introduce to some and to present to others a humble, kind, and honorable man that completed 10 years of higher education back in the 90s and became a board-certified infectious disease and internal medicine doctor during the height of the HIV/AIDS epidemic. And after graduation in 2004 until the present, for 21 years, with his Hippocratic physician's oath as his work ethic, he went to jail. Yep, Cook County Jail, Cermak, voluntarily committed and dedicated to making a medical difference in the lives of incarcerated individuals. In his 21 years, which is 5,460 days, 43,688 hours based on a 5-day work week, working in every unit in the compound and every security level. Dr. Chad Setwich has kept his oath and given the highest quality of non-judgmental professional medical treatment to his patients. He has followed his patients back to the streets with continued medical services at the Cook County Center, Cook County's Stroger Hospital, and other medical affiliates. In addition, over these 21 years, he has been at the forefront of numerous major research and medical projects, local and nationwide, that has helped the medical outcomes, of many. What he is most noted for within the populations that he serves is his ability to uplift his patients and to give them honesty, respect, and hope to know that what can be done will be done. His real down-to-earth approach has helped many patients to embrace their medical condition and push forward to make healthy lifestyle choices and changes. It is for this reason that they It is for this reason that they trust him in ways they have never trusted anyone before. Today, I give Dr. Chad Sedgwick a standing ovation for all his hard work, and I present to you the first Health Justice Legacy Award. Can we get a standing ovation?
Microphone, even better. The work that you have so graciously acknowledged today is something that every single person in this room is doing. So I'm standing here sort of humbly before you, and I'm grateful for this honor, but ultimately every single one of you is doing the exact same thing. I wish there was, 100 of these to pass out. Doing this for 21 years has been hard. It's not, I didn't think this was the way my, career path was destined, but it sort of chose me. And I just want to use this as an opportunity to encourage and acknowledge you to continue to do what you're doing. It's incredibly important and incredibly rewarding work. It's inspiring to see a room filled with like-minded individuals, and as I'm in the I hate to say this, but like the final third or so of my career, I continue to see I call them next gen coming through, the students, the residents, the trainees, the case managers, the social workers, the wraparound service, everybody in these organizations continually step up and inspire me and keep me going. So you guys are the fuel of the future, and I just want to thank you all for the work that you're doing. Thank you.
Thank you. Thank you. God bless you. Come this way. Okay, thank you.
Hey y'all, I'm back. So I just want to say that congratulations to the awardees. I just want to say that we are, it's winding down. It's almost time to say goodbye. Before we get there, I would like for you guys, and I just want to say this while I have the opportunity. It was such an honor to serve on the planning committee with Brittany, with my other planning committee members. Some of them not here, some of them are. It was an honor. I think that this will be greater and greater next year. It is exactly where I wanted to be today. But please join me in giving our 2025 Community Reentry and Champions and our 2025 oh no, that's not it, Brittany. I'm sorry. During this time, we will announce our HOVA contest winners. The winner for the icebreaker activity is Cindy Casey. Cindy, okay, Cindy, you racking up. Okay. And we got our little PHIMC thermal mugs. You put your coffee, your hot chocolate and thing. Okay, Cindy. There you go. She told me she walks slow. Okay. The winner for the HOVA photo contest is Jennifer Wren. Jennifer, are you here? Jennifer? Oh, she left. Okay, so the Academy will accept it on her behalf. Yes, and the leaderboard, the highest score on the leaderboard in the HOVA app for this event goes to Kara Phillip. The way she hit the table. You win! Okay. And with that, I'm going to turn you back over to Ah, I love Brittany. She's been so flexible. To Brittany. Here you go.
Thank you so very much. All right. So thank you all for being here today. We're going to go ahead and close out. So we want to do some special thank yous to the Illinois Reentry Conference VIPs. So as we close out today, I and PHIMC would like to give another huge thank you to our amazing conference presenters and artists and all of our conference participants. We would also like to give a huge thank you to the PHIMC's champion sponsor, Quattro, as well as the Reentry Conference sponsors, HIV Care Connect and the Illinois Public Health Association. I would also like to recognize PHIMC's funders, Illinois Department of Public Health, ViV Healthcare, and the AIDS Foundation of Chicago. Additionally, I would like to acknowledge all external conference planning members. Right now, we have a couple in the space, Mr. Crayton, Lexus, Vance, Dr. Latrice. There are so many more. Thank you so much. This is a collaborative effort. Could not have been done without collaboration, so thank you. If you could please allow me to also thank you for your dedication, you all, and just hard work in supporting the planning of this event. Again, it was a collaborative effort. And then finally, we want to give a special thank you to Kara Collective, who graciously opened up their space for PHIMC to host our pre-conference mixer that took place yesterday. Thank you. It is imperative to PHIMC that we do not leave this space as strangers. It is imperative that we stay connected. So I want to go ahead and do our call of action, okay, to all of the conference participants who are here with us in person and who are here with us virtually. We want to just say thank you. And as we conclude the conference, we want to just encourage you all to walk away with a renewed commitment to health justice and reentry. Our theme, Health, Justice, and Healing, Navigating Reentry with Dignity, Support, and Commitment to Health Justice, has highlighted the critical role that everyone plays in creating pathways for folks who are justice impacted. The conversations, the knowledge, the connections shared today, just the beginning. Please stay connected in the powerful work that you all do. Please continue the dialogue. Please advocate for holistic health resources necessary for successful reentry. Let's carry forward the lessons learned today and the strategies we discussed, ensuring dignity and support at the heart of the reentry journey. Together, we can transform systems, uplift individuals, and work towards a future where health justice becomes a real reality. Thank you again for your participation in today's conference. Thanks for being with us all day today. And let's continue the vital work side by side. Thank you. All right. And just lastly, as we wrap things up, I would like to remind you all that conference attendees, this is really important, especially for folks who need CEs, continuing units of education, and just want to stay connected with us afterwards, 30 seconds. As we wrap things up, PHIMC would like to remind you all, conference attendees, to please complete the evaluation for today's sessions, for today's conference. You'll need to complete the overall conference evaluation, and you will need to complete the morning workshop evaluation and the afternoon workshop evaluation. It really is imperative because it really helps support us in the work that we do. So please, we just want to create space for that. We really encourage you all to complete the applications, not just one, all three. Overall conference, morning and afternoon. Okay, we also would like to hear how you would want to incorporate feedback as we continue to evolve. So it's another reason why completing the evaluation is imperative. If you register for CEs, you must complete the evaluation for each breakout session, morning and afternoon, and the full day of the conference. And there's some other requirements that were listed in your registration as well. You want to follow all of those requirements in order to successfully ensure that you receive a CE. And remember, for CE folks, you must complete the evaluation 72 hours past today's event. So I just encourage you all to take a moment today and just complete the evaluation. It's not too long if you can. Okay, we also want to hear from you and encourage each other to upload your photos, your quotes, and your comments to the conference app. The app will remain open for 30 days post today's conference. So just join us in spreading the word also around today's amazing event to your networks. Like, don't stop the hashtag Illinois Reentry. Keep it going. Keep sharing pictures. Share pictures with us if you all would like. And for those of you all who would like to share your thoughts in a deeper way, we'll be conducting short interviews in the common area space, or could be possibly in this space, depending. So feel free to stick around and be connected to our communications team. To end our day on behalf of the Public Health Institute of Metropolitan Chicago, this has truly been an amazing day. And we would like to thank our in-person attendees as well as our virtual audience. Thank you so much for your participation today. We look forward to bringing you all together again next year, and thank you for your time this year. Please have a wonderful and safe day. Thank you.